Are you struggling with insomnia, exhausted but unable to stay asleep, dealing with anxiety that seems to come out of nowhere? Or maybe you are experiencing heavy, irregular periods that are disrupting your life. If you are in your 40s or 50s, there's a good chance the culprit is progesterone, or more accurately, the lack of it. Hi, I'm Dr. Indrani Raman. Stick with me, I'm going to talk a lot more and enlighten you on this hormone. This is one of the most important hormones in a woman's body, yet it's the one that most women know the least about. And when it declines, which happens years before menopause, it can turn your life upside down. So today we are going to talk about what progesterone does, what happens when it disappears, and what you can do about it. Let's dive in. Progesterone is a hormone produced primarily by your ovaries after ovulation. Think of it as a calming, protective hormone. While estrogen is stimulating and builds things up, progesterone balances estrogen out and keeps everything calm and stable. Here is what it's doing in your body. It regulates the menstrual cycle. That means it prepares your uterus for pregnancy. It protects your uterine lining from overgrowth, which can lead to cancer. It supports sleep by calming your nervous system. It reduces anxiety and promotes a sense of calm. It supports bone health and works with estrogen to keep those bones strong. It also balances estrogen to prevent estrogen dominant symptoms. Progesterone is essential not just for reproduction but for overall health and well being. This is what most women don't realize. Progesterone starts to decline in your late 30s and early 40s, long before your periods stop. So during perimenopause, you may still be having periods, but you are not ovulating every month. And if you don't ovulate, you don't produce progesterone. And this creates a hormonal imbalance where estrogen becomes dominant. This is why so many women in their 40s experience heavy irregular periods or flooding, insomnia, you fall asleep but you're waking up at 2 or 3 a.m. and can't go back to sleep, anxiety, irritability, mood swings, breast tenderness, fibrocystic breasts, even weight gain, especially around the midsection, and brain fog and difficulty concentrating. So these are not just normal aging, these are the symptoms of low progesterone and estrogen dominance. The good news, there are things you can do to support progesterone production naturally during this phase, like managing stress, which is high cortisol is suppressing your progesterone. We got to get adequate sleep, 7 to 9 hours. And there is something called seed cycling, consuming flax seeds and pumpkin seeds in the first half of your cycle. Sunflower and sesame seeds in the second half helps to support hormone balance. But as you move closer to menopause, natural production eventually stops altogether. So once you reach menopause state, which is defined as 12 months without a period, your ovaries stop producing progesterone entirely. You're living with essentially zero progesterone in your body. And what does that look like? The symptoms will be severe insomnia and difficulty to fall asleep and non-restorative sleep, increased anxiety, depression, palpitations, hot flashes, and night sweats because progesterone is needed to regulate body temperature, joint pain and stiffness, increased belly fat, difficulty losing weight, and low libido, of course, brain fog and memory issues. So, without progesterone, we are also at risk for certain health conditions, especially endometrial cancer risk, because if you're taking estrogen without progesterone, especially for women with uterus, you are at high risk for that. We're at osteoporosis risk because progesterone is important to build bones. Cardiovascular disease risk because progesterone has protective effects on the heart. Cognitive decline risk. It may increase progesterone support. Progesterone is needed to support the brain health. This is why progesterone replacement is not about just feeling better, it's about protecting your long term health. Now, I want to briefly bust some myths about progesterone in the next few seconds we talk here. Before we talk about solutions, I want to talk about some of these myths. Number one, progesterone makes you gain weight. The truth, progesterone actually helps with weight management by balancing estrogen and reducing water retention. Weight gain is more often caused by estrogen dominance or low progesterone. Myth number two, I can just use progesterone cream from the health food store. The truth, over the counter progesterone creams are not regulated. They often contain inconsistent doses or not absorbed reliably. They are not a substitute for prescription bioidentical progesterone. Myth number 3, synthetic progestins are the same as bioidentical progesterone. Truth, they are not the same. Synthetic progestins are chemically different and they come with more side effects, including increased blood clot risk, mood issues, and weight gain. Bioidentical progesterone is molecularly identical to what your body makes and has a much safer profile. So, what is the solution? You need that bioidentical progesterone replacement therapy. So, according to standard medical guidelines, progesterone is essential for any woman on estrogen therapy who still has her uterus. It protects uterus lining from overgrowth. However, many practitioners, including myself, believe all menopausal women can benefit from progesterone replacement because it is needed for sleep, mood, bones, and brain health benefits even without estrogen. And our body is used to having both of them in balance even before menopause. So we need to keep it that way. What type should you use? Look for bioidentical progesterone, specifically oral micronized progesterone that's free of unnecessary fillers. This form is well absorbed, safe, and effective. It's typically taken at night because it has a calming effect that supports sleep. What about topical progesterone? I've seen some clients ask me about that. Some women use compounded bioidentical progesterone cream, which can be effective. But oral micronized progesterone is generally the gold standard for protecting the uterus and providing the systemic benefits. Definitely avoid synthetic progestins. These are chemically altered versions that don't provide the same benefits and come with more risk. Make sure you're asking for bioidentical progesterone, not the synthetic versions. So if you're experiencing any of the symptoms we talked about, that insomnia, anxiety, heavy period, weight gain, brain fog, progesterone could be that missing piece of puzzle. Here is what I want you to do. Talk to your doctor today about bioidentical progesterone if you are in perimenopause phase or going through menopause right now. Ask specifically about oral micronized progesterone and whether it's right for you. And if you're looking for a more personalized approach, and if you want help understanding your symptoms and navigating advanced hormone testing and creating a customized plan that works for your body, schedule a free discovery call with my team. The link is in the description in our bio. Listen, progesterone is powerful, it's calming, protective, and essential for health. This hormone is especially important during perimenopause and menopause state. And the good news is you don't have to live without it. You deserve to sleep well, feel calm, and protect your long-term health. And progesterone can help you to do that. Thanks for watching. If this video was helpful, give it a thumbs up, subscribe for more hormone health content. I'll see you in the